now I am turning it back to Oprah Granholm. Sorry, to Melanie.
And he helped me get out of the chair without falling out of the chair, as I did a few minutes ago. As all of you know, we talked about the Lighthouse Forum last week. We're having this forum here today. We'll be going to Vermont and Iowa and California and around the country. It's really important to President Obama that we talk to you about what you consider to be important. We have a website that people are sending ideas to. We have the community healthcare discussions. So there are a number of different ways that we are trying to engage you and get your opinions. What I'd like to know is, what is the most important message you think legislators, the congressmen here, their colleagues, senators, need to hear from the American people about health care? I mean, when I was traveling around for the campaign, over and over, people would say, how do we get this done? How can you make sure Congress and the President signs the bill into law in the very near future? I want to hear from you about what you think is important. Why don't we take a question here? Yeah, why don't we start? Yes. She's got a microphone right behind you. Can you give us your name?
Yeah, my name is Ron Mays. I'm currently unemployed, but I have health insurance from my previous employer. This question involves both employed and unemployed people. And I heard this brought up during the campaign. I heard President Obama mention he wanted to do something about it, and that is the question of a pre-existing condition. I think that today's condition, knowing that people do change jobs, is going to become tomorrow's pre-existing condition. And even for insured people, this could become a problem. So my question is this a priority? And if so, how do you plan to legislate? I think the answer is more complex than just saying there's no such thing as a pre-existing condition. So that's important to me.
Right, no, absolutely, and you're right. One of the things the President spoke about on the campaign trail was the importance of making sure that as we reform our healthcare system, that we don't do it on the backs of people who already have a healthcare condition. I mean, unless we all plan to be young and healthy forever, I mean, pretty much everyone in the room is going to have some kind of healthcare condition, and if you can't take your healthcare with you, as you're moving from job to job, and if we don't make sure that insurers aren't able to cast people aside because you've got a chronic heart disease, or you've got diabetes, or your child has asthma, then we aren't going to be able to bring everyone into the healthcare system, which ultimately makes sure that we're able to drive down costs. So that's one of the values, one of the principles that the President takes into this healthcare conversation. And what he said is, I articulated a plan when I was on the campaign trail. Obviously, I thought that that was a good plan. What I want to do now is to work with Congress to make sure that we can move forward and hear their ideas, put everything on the table, and draft a plan. But that's certainly one of the principles, one of the values that he brings into that conversation.